Let's talk about you. Let's talk about this new business, because you've been talking to me about it for quite some time, and now it's all coming into fruition, and it's very exciting. Talk about that.
Well, thanks. Yeah, no, basically RxMatch is a medical social platform in which we match people with similar diagnoses. So if you have a back condition and you've been struggling with that.
Which he knows I do. I have some herniated
hypothetically speaking, you can be matched up with someone as young and as active and as fit as yourself.
Or that doesn't want to slow down.
Doesn't want to slow down, has a crazy life and is all over the place like yourself. Or someone who's a little bit older, is not as healthy. So we match you up with someone who's just like yourself, and you can see if I were to do surgery, if I were to do therapy, what people have actually experienced. So you're really proactive in your care. You're really taking a, educating yourself with other people who've gone through all those different treatment options, and everyone brings certain preconceptions into their treatment and different slants and how they think they should be treated, and kind of being an active player in your own care.
And is it knowledge? Power, right? And sometimes you learn just by talking to other people who have seen other doctors and know about other treatments. Because doctors are wonderful, but it's hard for them to stay up on the latest, greatest research.
Yeah, no, the reality is there's this huge patient movement that's going on, the e-patient revolution. It's really all about empowering the patient and listening to their voice more. In the past it was all about the doctor knows, and even though doctors are central to all this care, the patient voice is still, we don't really know that. To have the finger on the pulse of what the patient's saying, that's what this is all about.
And the great thing is it takes out the middleman, the insurance company, which really irritates me because they dictate a lot of the treatment. So it takes them out of the equation, and patients then have even more power.
You hit the nail on the head, because the reality is what we're trying to do is, if we lead this revolution with the patients and having the patients at the center of it, this is what's going to change healthcare.